By listening to this podcast, you agree to not use this podcast as medical advice to treat any medical condition in yourself or others, including, but not limited to, patients that you are treating. Consult your own physician for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the podcast. Under no circumstances shall any guests or contributors to the podcast or any employees, associates, or affiliates of the Neuroendocrine Cancer Awareness Network be responsible for damages arising from use of this podcast. Welcome, everybody, to another edition of Let's Get Real with NCAN. I'm your host, Mike Wayman. And before we get into this episode, I do want to remind everybody that next Saturday, October 14th, will be our Miami Net Patient Conference. That'll be happening in Miami, Florida. For more details, go to netcancerawareness.org. Also, please make sure that you're signing up for your virtual walk participation. You will be getting these awesome shirts sent out to you as long as you register. And also, don't forget about our gala here in Long Island, New York on November 11th. That will be at the Sterling in Bethpage, New York. More information and tickets and all of that stuff, you can find it on netcancerawareness.org, as well as our social medias at NetCancerAware. Today, we actually have somebody that is not intertwined in the NCAN story just yet. I'm sure we'll suck her in somehow, but we have a really awesome story. New patient, Katie Gilmore. Katie, welcome to the show.
Thanks so much for having me, Mike. Excited to be here.
Yeah. Now you have a pretty unique story. You're also a fairly newly diagnosed patient. So why don't you let us know a little bit about yourself, where you're from, and your story.
Definitely. So my name is Katie. I am 32 years old. I live in New Jersey with my husband and my 2.5-year-old son. I found out I was pregnant in early March of this past year. And it was very exciting news for us because I actually was pregnant earlier in the fall of 2022. And then I had a miscarriage in January when I was pretty much just through the first trimester. I was about 13 weeks. So it was pretty unexpected. I had already heard the heartbeat and everything and seen the baby. So we were really excited to get the news of the pregnancy. And as anyone who's been through pregnancy or been through, the unfortunate loss of a miscarriage, any subsequent pregnancies are pretty scary and pretty anxiety provoking because you just hope and pray that what happened doesn't happen again. So I was kind of holding my breath, literally and figuratively, even though I didn't know it, during the first 12 weeks of the pregnancy. And around 11 and a half weeks, I was sitting on the couch with my husband and my father-in-law, and we were watching some TV. I was eating some ice cream. It was, 8:30, 9 p.m. And I started coughing, and it was an unusual cough, and it continued. And I asked my husband to grab a paper towel for me because I could feel something in my mouth. And so what I felt in my mouth, I spat onto the paper towel and I saw blood. And I had never seen that before. So we were a little caught off guard. I sat up and continued coughing, stepped outside for some fresh air, and the blood continued. It continued for about maybe an hour and a half or so that night. I went to bed, slept fine. Wasn't coughing through the night or anything. And the next morning, I woke up earlier than usual, and the blood was worse. Started the morning with a cough, and it continued for about 2 hours that morning, and it was pretty intense blood. So I went to bed hopeful that it was going to be a one-time thing, and woke up and was like, okay, something is not right here. So got in touch with first my mom, and she was like, you need to go to the doctor. And then I called my OB and midwife practice, and they said, go to an urgent care or an ER. So we drove to the ER close to our house that my OB is associated with. And I was admitted there. And as everyone who's been to the ER knows, it was quite a long time of waiting and testing and everything. And it was weird going there because the coughing and bleeding had subsided for the time. So I was perfectly fine walking in. I felt weird taking these medical resources from other people who might actually have an emergency, because it didn't feel like an emergency to me. So about 12 hours later, after, blood work, EKG, X-ray, CT, the nurses starving me and telling me I can't eat in case I need surgery, me losing my patience over that because I'm pregnant and starving. I am admitted to a different floor in the hospital, and that was internal medicine, I believe. They say they want to keep me overnight to run more tests. And then the starving actually continues into the next morning. I'm told I can't eat. You can't eat. We might need to get you into surgery. We need to do a biopsy, because what they had found in the X-ray and the CT was a mass in my left lung. We really didn't think it could be cancer. I am what we thought. I was a perfectly healthy 32-year-old woman. I had run a 5K 10 days prior to this. I am pretty active. I'm a runner. I was an Irish dancer my whole life. I have a 2.5-year-old, so he forces me to be extremely active. I never really smoked, when I was a young teenager and I was offered a cigarette or two, maybe I had. Just curiosity killed the cat, but no more than 10 cigarettes in my entire life. So we really didn't think that it could be cancer. And then finally around 2 p.m. the following day, so that's like 24 hours later after I first went to the ER, an oncology thoracic surgeon comes in. And even hearing the word oncology, I'm still kind of like putting a blocker up in my mind of what this could be. He comes in and he wants to show my husband and I the imaging from the CT scan. And that was the first time we heard the word carcinoid. He said, we don't know what it is right now, but this is what it looks like. So, of course, as soon as he leaves, after, giving us the slideshow of the images and sharing his preliminary thoughts, we jump to Google, and we don't love what we see. And, we share with family, and we're still very much, in the waiting game. Tomorrow is going to be the biopsy. They told me I could eat, so I was very excited about that. And the next morning was when I had the biopsy. That was pretty scary. My mom came right before that, and before any surgery, you're in that like pre-op waiting area, and you're just like, wow, what's about to happen? What are we about to find out? So I go in and they do a bronchoscopy. They go down my throat and take a few samples from my left lung. And while I'm in the recovery room after that, the surgeon is sharing with my mom more preliminary thoughts after he had gone in. He said we still have to wait to hear from pathology once we send the specimen out. But I'm thinking now it could be a lymphoma. So that was the first time we heard lymphoma, which of course was different from carcinoid. This was all on a Thursday, and we did not get a call from the surgeon until the following Wednesday. I was discharged from the hospital Friday, the day after the bronchoscopy, and the waiting that ensued that weekend and into Monday and Tuesday before we got that call was just absolutely brutal. It happened to be Mother's Day weekend, so that was a blessing. It was a beautiful weekend in May in New Jersey, and everyone was, heightened and scared, and so we spent the whole weekend together. My family lives very close to me, so I was fortunate to have my my loved ones near me as we waited. And then I think it was the day before we got the call from the surgeon. I had been checking my chart on my phone, on my app. And when I checked it, I saw that there was a new report in, and it was the pathology report. So I opened it, and that was the first time I had seen neuroendocrine, that word. Even when I looked up carcinoid, I must have stopped myself from like digging deeper because I didn't recognize the word neuroendocrine tumor. And even then, at that point, I was still like in disbelief that this could be a type of cancer. How could I have cancer? This is crazy. I'm healthy. This is not, I feel pretty much fine. If I didn't cough up blood, none of this would be happening right now. So I saw that report, and then it was the next day that the surgeon called, and the following day, which was a Thursday, so a week after the bronchoscopy, I went in and we spoke to the surgeon. My husband and my dad came with me. And before speaking with him, I was even in the hospital, and then up until we stepped foot into his office, I was under the impression that this was going to be quickly taken care of. It's a tumor. Okay, it's cancer. Let's just get it out. We sit down in his office, and he tells me that because of the size and the location of the tumor, I will most likely need to lose my entire left lung. We were all surprised by that. We didn't think that was going to be the news that we were going to be hearing. So obviously we had many, many questions. How can somebody lose a lung? Or am I going to be okay to live after that? We, after that appointment, decided to pursue several other opinions. We're fortunate to be in New Jersey, in an area where there's a lot of, expert medical professionals in the area. We're about 40 minutes outside of Manhattan, an hour and a half outside of Philadelphia. So my people, my family, my friends, any connections we had, got on the phone, emailing anyone we could who could get us into the many hospitals and surgeons and oncologists around the area to see what they thought. The other scary part about the first appointment with the surgeon was that he said I should get surgery pretty immediately. So here I am at this point, 12 and a half weeks pregnant. So in the same spot, basically, where I lost my baby in January. And now I have this baby, and I think I can take a deep breath, but I can't, because now I learn I have cancer. And I need to have surgery, and I need to have it immediately, because if I don't have it immediately, I am risking a lot. I'm, of course, risking my health, which is risking the baby's health. But surgery early in pregnancy is also not ideal. So we continue on. Over the next 2 weeks, we see and speak with 5 other surgeons. And it was 6 total we spoke to. At the 5th appointment, it was the first NET specialist that we had seen. All of the appointments leading up to this one were pretty much just like general thoracic oncology surgeons. We go to the University of Pennsylvania, and we see a doctor there who's a specialist, and he is the first doctor to say to me, you can wait until this baby is born to have the surgery. He agrees that I will likely be losing my entire left lung. No one really wants to say that until they go in and actually see it. But unfortunately, we got a second CT in July, and the tumor has grown. So it definitely seems likely that I'll be losing my whole left lung, but I'll be gaining a baby. So, and the other opinion that was aligned with the surgeon at UPenn was an opinion from a doctor at Memorial Sloan Kettering, which I'm sure everyone knows that hospital because it's one of the top cancer hospitals in the country, in Manhattan. And so we were so relieved to hear that, because we were just, on the edge of our seats. Like, am I going to be going in for surgery in the next few days? And what's going to happen to this baby?
Right.
So then became kind of like the next difficult step in the process of making a decision. It was, the minority of opinions were saying you can wait, and the majority was saying you should do this now. And it was scary to go with the minority of opinions, because why would I do that if most people think I should do it now? But I've heard this from other guests that you've had on the podcast of making sure that you trust the doctors that you are choosing to partner with to keep you healthy and to get you healthy. And I did have, when I met the doctor at UPenn and when I met the doctor at MSK, I had this feeling of it was probably just immediate relief because of what the news that they had shared with me, that I could wait. And my baby would most likely be safe. But just this instinct, mother's instinct, I don't know, patient's instinct, like within me, that it was going to be okay for me to wait. So that's what we've decided to do. We are waiting until the baby comes to have surgery. The baby was due at the end of November. We are pushing that up to early November just so that we can push up the surgery. And so that's, in a nutshell, I know I just spoke for a long time. That's my story in a nutshell.
Yeah, I mean it's again, it's a unique story, and it's something that people don't necessarily realize, that neuroendocrine does affect people that are younger. Everybody's kind of used to some of the older people being affected by it, but something that I wanted to do with this show, and we've had a number of younger people on the show, and it does affect younger people. So, and people who are in great health and run marathons and stuff like that. So it doesn't discriminate. So that's really important. So you said that you saw a net specialist. Why do you think it's so important for people to see a specific net specialist? I mean, especially, you're a few months into this diagnosis. Why do you think it's so important for somebody to see a specialist?
Yeah. I think the rareness of neuroendocrine cancer is really what makes it so important. The more that I read and learn and, listen to, I just keep hearing that there's not enough research and knowledge about this type of cancer. And so why not go to somebody who has the more specialized information and practices and experience? We were really ready to go with a general oncology surgeon, whether it be the one who found it or, somebody at a different hospital in Manhattan, because there was urgency. You find out you have cancer, you want to get the cancer out, and that's a very normal response. And had it really not been for my family, my husband and I probably would have jumped right to it because we were so frightened. My husband lost his mother to cancer about 7 years ago. And so there's an open wound there for him. And it's like, oh my gosh, now my wife has cancer. We better take care of this immediately. And, hopefully God takes care of the baby. And it was really my parents who encouraged us to just take a step back, recognize the urgency of the situation and do whatever we could in the next 2 weeks to get to a specialist. Something that gave me reassurance during that time period of waiting was the first surgeon said, this has probably been growing slowly in your lung for about 5 years. And so in the back of our heads, we were thinking, if this has been growing for 5 years and we need to wait another 2 weeks or so to get some more experts, eyes and brains on this, I'm not going to die in the next 2 weeks. And if I do, then that would be just horrible and crazy, but I won't. So knock on wood, I'm telling that tale. So thank God we did. Thank God it was my brother who is in business school right now, and one of his friends' brothers works with this surgeon who has a really busy schedule, in the OR, and he's also a teacher at Penn. And so had it not been for that connection that my brother had, we probably wouldn't have been able to get in as quickly. The next opinion from MSK, that was quite a bit later. It was about, I think, 2 weeks later. And so it was the one opinion for about 2 weeks that kind of held us over. And then when we got that second one from MSK, that really gave us the reassurance that we needed to feel comfortable waiting for the sake of the baby. But if you can get a specialist, you need to. Anyone else in the field, I feel like will tell you that. My sister's friend is a nurse, and she said, it's not a standard cancer. It's not a cancer that everybody knows about. Nobody has heard of this cancer. Nobody knows what's best. And, within the umbrella of neuroendocrine, there's different types even that fall under that. And so you have to find someone who has the specific knowledge and experience.
Now, you said that you saw about 6 doctors. Of the 6 doctors, how many of those doctors seemed like, not like experts, but like well-versed on NET?
It was kind of hard to tell, to be honest. The first one said it's probably been growing for 5 years. Then we had a doctor say, maybe 1 or 2, and kept asking me, you're not a smoker, you're not a smoker, you're not a smoker. So when I play back those conversations I had with those doctors, and I think about the knowledge I've gained about my specific type of cancer, I'm like, I think it's pretty clear that they don't have, I'm sure they're renowned surgeons, they're expert doctors, but they don't have the knowledge that a NET specialist does and would have, and be able to inform me the way that I need to be informed. So then I had another, right now surgery is, everyone feels pretty confident that surgery will be my only treatment. We're still waiting on a PET scan, and that needs to happen once the baby is born, a PET dotatate scan. I can't have that because of the radiation. Wow, pregnancy brain and brain fog is real with cancer too. Read that. Double whammy for me. But I had one doctor talk to me about some chemo options. So even that, I heard from majority of the doctors that this type of tumor will not respond to chemo. And then I had one tell me about chemo. So I'm so grateful that, my parents pushed us to get these opinions, because getting the opinions was a part of, the learning journey of what is this and what are we going to do about it? Had we not seen all those doctors, again, they're all experts, and just some more than others in NETs, we wouldn't have learned what we learned and what we know now. And so I'm grateful for that.
Yeah, absolutely. Why, and you again, the pregnancy is a real unique case in this situation. Why do you think it's so important for the patient to be involved with their treatment plan?
Yeah, that's a good question. Because it's all for you. And at the end of the day, you're going to be the one that's sitting in the hospital bed. You're going to be the one that, is in the operating room. You're going to be the one whose body is being cut open and worked on and needing to heal. And so there were many points where I wanted people to just make the decisions for me and, talk to the doctors for me, and I could just kind of be told what to do because of how overwhelming it's been. That felt easier in certain moments. But it's your life, it's your body, and you need to be empowered to make the decisions and listen to the conversations and advocate for yourself. It's been a huge lesson for me in advocating for myself. The first x-ray I got at the ER, he was about to put the coat on me or whatever, and you know, when you go to get an x-ray, you see signs all over the place that say, are you pregnant or breastfeeding? And he didn't ask me, and I figured he had read my chart, and I said to myself, let me just ask him just to make sure. I said, you know, I'm pregnant, right? He didn't know. He said, oh, I need to go get another special, like basically cape to put over my stomach. And then a similar thing happened when I went in for my CT scan, which is much scarier than an x-ray when you go into that tube. And she said, I hadn't seen a doctor yet. I was still technically in the ER when I got the CT. And so she's about to put me through, and she's about to walk out, and she said, you know the risks of doing this while you're pregnant, right? And I said, I know there are risks, but I don't know the specific risks because this is all happening very quickly, and I haven't spoken to a doctor. And at this point, it's close to midnight, and I got to the ER around 2 p.m., empty stomach. And she's like, okay, well, do you want to go talk to a doctor about the risks? And we can come back and do this another time. And I said, no, at this point, I know I need to do it. I spoke to one of my midwives, and she said, you know, the benefit outweighs the reward, which is what I continue to read over and over again. And it's just one of those moments that you're just like, wow, I'm glad that you know I'm pregnant, the CT person, because the x-ray person didn't. But here I am just helpless on this table, knowing I need this, but knowing it's risky and having to do it anyways. And so from there on out, any appointment, 2 days later when I was getting my bronchoscopy, I said to everybody while I was sprawled out on the operating table before they put me under, I said, you guys all know I'm pregnant, right? And they laugh. They're like, yeah, we're all on the same page. I'm like, okay, just making sure, because some people apparently don't read the paperwork. And luckily I've had the support and other people helping to advocate for me. Because we were under a time crunch with the appointments, I had to send my mom to the hospital to get the radiology discs and drive them into the city to the various hospitals. Because there just wasn't enough time to get them sent over to them, and that was the best way to do it. And so having family in my corner kind of carry that weight and help me advocate for myself has been instrumental in helping me manage this.
Absolutely. Absolutely. So you're a fairly new patient, but in regards to getting proper care, to a new net patient, what would you say the most important decision a net patient is that they can make?
Yeah, I've kind of touched on this. I feel like one of the main things for me when I look back and think about, how we handled it in such a quick time period, seeking the multiple opinions was key, and it really stressed me out in the beginning. I have like screenshots from on my phone of all the phone calls I had to make, and then emails back and forth and documents sent over to various doctors. It was really intense. It was a full-time job. But without the opinions, you might not be getting the best help for yourself, and you deserve that as an individual. You deserve to be seeking the best treatment possible so that you can continue on with your life. And I'm so grateful, like I said, that we did get the many, many opinions, because without it, my life could look very different right now, and my family. And that is scary to think about. And so acknowledge the urgency and the stress in the urgency. But do what you can, and get your people to rally around you and be in your corner so that you can get the best care that you possibly can. Don't rush into those decisions, because there'll be decisions that you're going to be living with the rest of your life.
I couldn't agree more. Couldn't agree more. So, and I was going to ask you a little bit about advocacy, but you seem to be you've hit that already for sure. So Katie, we really want to thank you again for sharing your story with us, sharing the information that you've garnered in what it's been about 10 months that you've been a net patient. So you've already given so much to this community in terms of sharing that on the show. So thank you so much. And we're excited to see baby pictures. We're excited to see your progress and things that happen in November, and wish you all the best with that. And 2024, we hope to see you out at one of a conference or one of our events and stuff like that. The invite is always open for you.
Thank you.
Yeah.
My husband and I do love to party, so you can count us in for the parties.
Okay.
And I appreciate you hearing my story. I hope I can help somebody. I know that listening to a few of your episodes has helped me. I would love to talk to some of those people who also had to lose a log, because I know you know a few of those.
Yeah. That's what the net community is all about. And I not that it's a great thing, but for anybody who does get sick or diagnosed, something that I've learned in the 20 some odd years that I've been a part of it, there is no community like the net community in terms of the people that want to share, that want to help, that want to give more information. It's a very giving community. So I'm looking forward to bringing you in and having you share your story and having others share their story with you and give you a little bit more peace of mind and ease some of those negative thoughts that you may have.
Yes.
So, but yeah, thank you guys so much. And thank you everybody for listening. We'll see you next month on Let's Get Real with NCAN. All right. That's it.